The objective of our study was to better understand the relationship between vision, physical balance, and falls. In our study, we compared measures of physical balance and falls across those with normal vision, uncorrected refractive error, and visual impairment. Uncorrected refractive error meaning individuals that need glasses but don't wear glasses. And this is important because balance is an important part of mobility, and good balance helps prevent falls, which impose a large morbidity, mortality, and economic cost to our society, and falls are preventable. The study was a cross-sectional study based on a national survey sample. The sample consisted of 4,590 adults aged 40 years or above who participated in the National Health and Nutrition Examination Survey, otherwise known as the NHANES, which is supported by the NIH. Participants completed tests of standing balance with their eyes open or eyes closed. The purpose of the foam surface was to diminish proprioceptive input towards balance. And importantly, the last test condition was a measure of vestibular balance because the test aimed to minimize proprioceptive and visual input towards balance. Two aspects of our findings were interesting. One, that balance would be affected in those with poor vision even when they had their eyes closed, and that eyes closed balance would be worse than normal in individuals with poor vision secondary to uncorrected refractive error. These findings suggested that poor vision may lead to deficits in other sensory systems such as the vestibular system. And this association is unlikely to be due to a common neurodegenerative pathway, given that uncorrected refractive error, which is not a neurodegenerative condition, was also associated with worse vestibular balance. Our proposed model for our finding is that vision is necessary to calibrate the vestibular system. For the general public, it's important to understand that their vision, poor vision, could lead to worse balance, and that they should be checked regularly to make sure that they don't have any visual impairments or any pathology that may be affecting their vision and thereby their postural balance, increasing their risk for possible falls in the future.